just want to talk about a lot of the things we talk about in our consult appointments to just educate people about what's possible with breast augmentation. When I finished residency several years ago, there were basically 4 or 5 different implants you could put in to achieve breast augmentation. Today there are probably over 50 styles and shapes and textures of different implants that are able to be put into patients. So it is a whole new ballgame. There are implants being released all the time onto the market these days. Not that they're new and experimental, but they're used in Europe and they're finally making their way to the States. So it's an exciting time to be thinking about breast augmentation, and that's what we're going to be here talking about tonight. So let's get started. Okay, so I wanted to start by talking about some of the myths with breast augmentation. Most patients that come in here, at some point in their consultation, bring up one of these 4 things. Next, please. The first is implants need to be replaced every 10 years. They absolutely do not. They are not tires. They do have warranties, but they are not tires. And I kind of follow the old adage, if it ain't broke, don't fix it. Because if there's nothing cosmetically wrong with your implants, and they aren't causing you discomfort, and they aren't ruptured, there is absolutely no reason to do anything about your implants. There are many women that have had breast implants in place, be they saline or silicone, for decades and decades, and are still completely happy with them. And there are other women who end up having breast augmentation surgery and revisions 2 or 3 times within several months or several years. Some of that is based on unrealistic expectations and achieving, a perfect look in someone's mind, and some of that is because this is a surgery and it does have risks. So it's not that everybody gets a great outcome 100% of the time, but thankfully it's pretty close. So the next myth is that silicone is unsafe. Most people remember the Dow Corning scare in the early 90s, or at least have heard about it, when the implants, silicone implants, were taken off the market. There was a rheumatologist who treated several young female patients in their 20s and 30s who developed new autoimmune symptoms. And he reached out to the plastic surgery community because a lot of these women had silicone breast implants. And he asked, where is the research that showed that these devices are safe? The problem was they had no research to show they were safe. So there was nothing that ever showed they were wrong. In fact, they continued using these devices on women having breast reconstruction for about a decade, a little longer, and collected all that data and showed there's no risk of autoimmune disease, there's no risk of breast cancer, and there's really no risk of any other malignant cancers associated with these devices. So that's, something that we talk about a lot in appointments. Myth number 3, anesthesia is risky. Now, I don't want to say that anesthesia isn't, without risk. There are certainly risks to anesthesia, but it is a very safe experience for most patients, especially for an elective procedure as short as breast augmentation or breast surgery. All of our patients have clearance medically before surgery so that things aren't missed. A lot of the problems you hear about in the media are because surgeons and patients try to get around those safety parameters, and we simply don't do that. Something that the American Society of Anesthesiologists published was that you're 200 more times to die getting struck by lightning than you are to die getting anesthesia for an elective procedure. I don't think anybody in this room walks around outside thinking about getting struck by lightning. So it is something to think about, but it's very, very safe. Myth number 4, breast augmentation will look fake. Now, it is certainly possible for breast augmentation to look fake, and in fact, I have several patients that come in here with exactly that idea in mind. But breast augmentation can also look very, very natural if that's what you're going for. And that's what I want to talk to you about as far as the sizes and shapes of all the different implants that are available now. The gummy bear implant, also called the form stable implant, also called an anatomic highly cohesive silicone implant, all the same implant, is kind of the best chance for many patients to achieve that natural look. But you can get a very natural look with many different types of implants if a lot of things we talk about later are following. So how do we know which implant is best? There are so many choices now. There's saline, there are silicone implants. With silicone, they come in either a smooth surface or a textured surface. There's something we call different profiles, meaning the height of the implant given the same kind of what we call base width or diameter of the bottom of the implant. Form stable is something that refers to the type of silicone gel. It's a thicker, sturdier gel that tends to keep its shape, usually for those teardrop or anatomic shaped implants. Size is definitely something that we talk about with different implants. And cohesivity is something that's getting a lot of attention within the plastic surgery community lately. It refers to how thick or viscous or stiff the silicone gel is, and that affects how it interacts with the silicone barrier or shell of the implant, as well as how it stands up over time. So these are a lot of things to think about when you're picking your implant. Which implant is best kind of depends on where we put it. So for most patients, the implant is going to go under the muscle. And as you can see, the muscle edge from the pec muscle of the chest is pretty even with the nipple. So for most patients, the implant isn't 100% behind the muscle. It's partially behind the muscle and partially in contact and behind the breast tissue. And this is so that we can control the shape of the breast and make sure that the nipple is in the proper position on the breast and the implant isn't too high compared to where the breast is on the chest wall. So the other option is to put the implant above the muscle. This used to be associated with higher risks of what's called capsular contracture. That refers to scar tissue that builds up around the implant after it's put into the body. Your body is supposed to build a thin film of scar tissue that happens within 2 to 6 weeks after your implant going in. But in some women, that scar tissue thickens over time. Traditionally, this happened at a much higher rate above the muscle. Thankfully, with textured devices, those capsular contracture rates are cut in half. So whereas they used to be about 20%, be it mild or severe, there's about 20% of women were affected in some way. Now those rates are half that for most implants and even lower for some of the newer textured anatomic devices that are coming out. Next slide, please. So we can also think about how we're going to place the implant. My preferred approach for most patients is in the inframammary fold, the fold underneath the breast. Even if you don't have a well-developed fold before breast augmentation, most patients will afterwards, and it's an incision location that's indiscreet and it's hidden most of the time. It doesn't divide any breast ducts or directly divide any breast nerves. So for women who hope to breastfeed after surgery, it does give you a slightly better chance of being able to do so. Also, because we're not going through the breast ducts that have bacteria, there's a slightly lower risk of infection and capsular contracture when we go through the fold of the breast compared to the areola. That said, the areolar incision is a great incision for most patients as well, because even though those risks are a little higher, it's very, very little risk. The only time we can't really use the periareolar incision is if the areola is very small, or if we have one of the firmer textured devices and that distance is so short on the areola that it means that we'll have to traumatize the implant on the way in and increase the risk of rupture in the future. The transaxillary incision I showed just for comparison. I actually don't offer this incision as a surgeon. It can't be reused, so if you ever need another implant surgery in the future, you're going to end up with a second incision. And it tends to be harder to get the implants as low and as centered as they need to be coming from this outside of an approach. Next slide, please. As you'll see in this upcoming video, there are several differences between the saline and silicone implants. For most patients, you can get actually a very natural look with a saline implant. They do tend to project a little more and have a little more fullness and firmness to the top of the breast with the saline compared to the same size silicone. Most people think silicone feel more natural, but that all depends on how much breast tissue you have to start. The big cosmetic issue with saline implants is the risk of rippling, which is the ability to see this kind of rippled shell through the skin. If you have at least a B cup and you pick a small enough breast implant that it doesn't take tissue from your stomach and chest and bring it up onto your breast, you probably won't have rippling. But if you have less than a B, or you're going to pick a little bigger implant than the breast diameter currently, you probably want to go with silicone to give yourself the lowest chance of rippling possible. The other difference is what happens if a saline implant ruptures. With saline, your body will absorb that fluid like IV fluid, and your breast will be flattened, probably within about 12 to 24 hours. With a silicone implant, your body's scar tissue capsule that formed basically acts like a new shell for that implant. And for most women, they actually won't notice any kind of change in their breast if a silicone implant ruptures. For that reason, the FDA does recommend an MRI every few years after silicone breast augmentation, just to prevent potential complications like hardening of the scar tissue from the silicone or contact of the silicone with the breast tissue at some point. Okay. So the next slide is about the textured and smooth implants. So we've already talked about the fact that the textured implants have less risk of capsular contracture, which is hardening of that scar tissue. The other benefit of textured implants is that they do tend to stick almost like Velcro to the tissues. So they do resist getting pushed down and out to the sides compared to some of the smooth implants, especially for someone with really strong chest muscles, breasts that are kind of widely spaced to start, and one of those chests that kind of has a shape where the breasts tend to look like they're farther apart anyway. So for certain patients, a textured implant can definitely increase the longevity of your result and decrease your risks of having a bad outcome. Kind of, for some patients, the only negative thing is if you do want your implant to be very mobile, or you do expect your implant to settle, if you have a bit of sag to the breast and you're trying to balance it out with an implant, sometimes it is actually a little bit better to have a round implant that's smooth, that's going to settle in behind that breast tissue. So textured is generally a good thing, but it doesn't mean it's for absolutely every patient. Next is the form stable implants. And this is kind of an exaggerated slide. It really does show that with these form stable implants, the amount of silicone that is proportionally at the top of the implant, because the gel is stiffer, will tend to stay that way many, many years into the future. So it creates a very natural top of the breast and not a super amount of cleavage, but it really does tend to maintain it for a very, very long period of time. This does not mean if you get a round implant, oh, that's Marcelo, sorry. It does not mean if you get a round implant, your breast is absolutely going to look like this. This is kind of, for comparison, it's showing a very high profile implant in a patient that has no sag whatsoever. It does not mean that you can't get a very nice cleavage with a form stable implant. It just shows the basic difference between the two and the philosophy behind why those form stable implants exist. They tend to be very good with patients who have lost firmness to the top part of their breast and who have kind of stretched out sagging tissue, but not enough sag that they absolutely need a breast lift. They're a little trickier to use with breast lift patients because you need to get that implant in exactly the right position in the breast tissue and exactly the right position over top of it at the time of surgery. And it just tends to sometimes be a little easier to do with that round implant. Next slide. So the next thing to talk about with implants is the profile. And this tends to be what I talk about most with patients when we're talking about picking an implant. We tend not to talk much in volumes like 250, 350, 450, although eventually it basically comes to that. Each of these implants has a width or a diameter. And I very carefully measure the width and the height of the breast, as well as the quality of the breast tissue in the area to make sure that whatever implant we choose, your breast tissue is going to be able to cover it up, and it's going to accentuate the shape of your breast and not exaggerate any things that you don't like about your breast. For example, somebody who has kind of a pointed breast that sits very far apart, if you're using an implant like this, it's going to definitely exaggerate that. But for somebody who has kind of a lot of side breast and wants a lift and just wants something in there for a little bit of firmness and fullness but doesn't want to add, a lot of width to the breast, one of these higher profile shapes can sometimes be very effective. Women who have a very, very wide breast but don't want to go up much in size tend to want to go with one of the flatter styles because by the time you match the width of the breast, if you pick something that sticks out a lot, it's going to be a very, very, very large size. So there are lots of possibilities and combinations with these implants, and it really all depends on the look you're going for, as well as what you have to start with. So this is kind of our process for choosing the right size. Next slide, please. It starts at your first consultation. One of the very first things we'll do after talking a little bit about what you want out of your breast augmentation is to actually take a look at and measure the breast. As you can see, these are all very different shapes and types of breast. This woman ended up having an implant with a breast lift because her nipple is below the fold of her breast, and just putting an implant in there would either look like an implant way up here with a sad little breast hanging off of it, or a rock and a sock, neither of which anybody wants. So this patient actually has no breast sag and a pretty nice cleavage already, so almost any implant's going to work for a patient like this, and it just comes down to measuring the dimensions of the breast and picking an implant that fits. This patient has a little sag, but not as much as that patient. So this patient got an implant with a lift just around the areola. So just because you need a lift doesn't necessarily mean it's going to be a full lift, but it depends on whether you want your entire breast lifted or just the position of the nipple and areola. This patient has what we call a constricted breast. It's a long deformity called a tubular breast, where the bottom of the breast skin is very constricted. And the reason I show this is because this patient is never going to have the same cleavage and the same fullness to the bottom of the breast as that patient. What you start with definitely impacts the result you end up with. We can change a lot of things with playing with volume and using shaped implants and building the width and the height of the breast in the right dimensions. But sometimes your existing anatomy and whether you have asymmetric ribs really does play a role in what your final result is going to look like. Next, please. So the second step is really truly communicating about what you want out of your breast augmentation. Are you somebody who's going to wear a bra every day no matter what? You don't mind that? Are you somebody who wants to wear a strapless dress, a bathing suit all the time without having to worry about needing support? All these things really factor into what we choose. If you wear a lot of tight form-fitting blouses and you're a small person, too big an implant means that you're going to not be able to button your blouses, or you're going to have those annoying gaps in between. So these are all things to think about when you're planning breast augmentation surgery, and all things that are helpful to have an idea about before you come in the office. Do you want a very rounded top of the breast? Do you want it to be natural? So next slide. So we do often have patients bring in photos from swimsuit catalogs or Sports Illustrated or other internet photos, not to say we can make you look like that photo, but just as a comparison. Because I have patients that will come in saying, I want to be a very natural C cup, and then they show me pictures like the one that popped up. So a picture is definitely worth 1,000 words, because imagine me picturing a natural C cup and the patient picturing this. Even though we're both saying the same thing, we don't mean the same thing. So pictures are definitely a way for us to at least make sure we're on the same page. It doesn't mean you're going to end up with that result. It just means we're able to communicate about what it is you're looking for. Next slide, please. The next step for picking the right implant is actually trying on sizers in the office. This we can do for most patients who have existing implants and want to upsize, or patients who have never had implants before. And again, this doesn't exactly mean that the size you try on is going to be the size you end up with, because there are all those different profiles and shapes that factor into that. But it gives me a visual. And it also, if you bring clothing in, will help you decide what helps your clothing look good and what is too much for you. All right, next slide, please. It generally works best if you bring in a tight sports bra as well as a fitted cotton tank. But if you tend to wear a lot of loose shirts, wear those too, because how they hang from your body will make a difference as well. This is showing the sizing process in the OR. This is basically the last step of how we pick the right size in breast augmentation. When I go to surgery, I will have picked out 3 to 5 sizes in the office with you that match your frame, that fit our goals, that'll probably work with your breast. And then in the operating room, I actually try on either saline or silicone implants, depending on the type you're getting. I do have form-stable implants to try on as well. They're called sizers, and they're made just for that purpose. And the whole point of that is to see exactly what that implant's going to look like in your body before we take it out of the box and you purchase that implant. Because there are some patients I'm very surprised that they need 2 different sizes from side to side, or sometimes even 2 different profiles or shapes. And we can anticipate it a lot of times in the office, but sometimes we can't. And sometimes we'll pick a size in the office and I get to the operating room and put it in, and it's either very underwhelming or very overwhelming on the patient, and we end up changing the size slightly based on that picture we've both developed in our head at the appointment. So this refers to our use of Cosmetic-Sure. Cosmetic-Sure is cosmetic insurance. That means that if something happens dramatically to your health after surgery and your health insurance doesn't cover it, you're not going to be out of pocket as long as it's covered by the policy, which most things that are happening after surgery are. Episodes of bleeding, a trip to the ER for a UTI, things like this are covered under this policy at the first 30 days after surgery. Thankfully, the implant companies also have excellent warranties against capsular contracture and implant rupture at this time. Kimberly and Rob, who's our local implant rep, can fill you in on the details of those if you're interested. But Oh, there they are. All right, thank you. Next slide. And after surgery, we really do keep close contact with our patients. I answer a lot of questions for Real Self, and I'm very surprised sometimes to find people posting on Real Self saying that they had surgery a month ago, they haven't seen their surgeon, they've called the office, they've been blown off, and they have questions about their surgery. That's not going to happen here. Kim's cell phone is all over every piece of paper you will ever get before your surgery. If you have problems or concerns, you can call or text her immediately, email her all the time. If you have a concern that's more medical in nature, you can call the office and push 9 to get through to my cell phone all the time. So we're here for you after surgery, whether it's a medical concern or just you're having a bad day about your implants and you're worried about how they're settling and you need to ask some questions, we're here for that. So this is about risks and recovery. In general, most patients will recover pretty quickly from breast augmentation, even if they have a breast lift along with it. It tends to be the muscle stretching that is the biggest part of the recovery for most people. So adding a breast lift really doesn't affect the recovery significantly. For people who have an implant above the muscle, recovery happens as quickly as 2 weeks. You do still want to be careful about really strenuous activity, but at that point, the risks go dramatically down. For implants that are below the muscle, which is for most patients, there's no cardio activity for 2 weeks because that will increase your risk of bleeding and bruising. And it will set you up with a higher risk of capsular contracture in the future because even small amounts of bleeding and inflammation can lead to that at some point. Rest, ice, elevation, and compression are the keys for post-op recovery. You can see the RICE protocol. It's the same thing you have when you sprain an ankle, just a way to decrease inflammation. Most patients take anti-inflammatories after about 3 or 4 days. And until that 3 or 4 day period goes by, we give patients Valium and narcotics, which gets people through those first few days. Next slide, please. So there are definitely risks with breast augmentation. Most of these women have bad breast augmentation because they chose an implant that was too large for their body, but some of them didn't. This patient has really bad capsular contracture and also has saline implants that were placed above the muscle. For someone who has no breast tissue and no fat to hide an implant, even though above the muscle is easy, it definitely is not going to look natural and not going to look good. You can see poor Kendra has capsular contracture on her right breast, which has made it twice as high as her left breast, and it almost looks bigger. I'm debating whether she had a deflation on that left side as well because something is not right there, and I probably would have worn a higher collar to that end. I'm not even sure what to say about the next few. This actually represents synmastia, which is a really, really bad complication, meaning that the dissection has happened to try to get the breasts too close together. Once you lift up those tissues and you kill that separation between the breasts, it's very hard to get it back. So you do want to be cautious about picking an implant that's appropriate size for your chest because they had to do that to make room for this implant, and they shouldn't have. So, next slide, please. So there are reasons to get a breast augmentation revision. As I mentioned earlier, with smooth implants, there's about a 20% risk of developing some form of capsular contracture over years and years after your implant. For most patients, it's a very mild degree. I actually have capsular contracture on my right. It feels a little tighter than my left. I notice it, my husband doesn't notice it, nobody else notices it. I'm never gonna have surgery for it unless there's some other reason to do something. But that's what it is for many, many patients who get it. Unfortunately, for a small percentage of patients, it does get like you saw in those photos where the breast can become high and hard. And that happens whether the surgeon has done everything properly and whether you've done everything properly as a patient. It's just a risk of surgery. So if that happens, there are medications now that are related to asthma medications that we can use to quiet down the immune system. Those sometimes help. Otherwise, it's surgery to remove the implant and replace it. This is just one of our patients from our video online. Some of you may have seen it. Her surgery is cataloged in this, and you can watch all the way through. It talks about her pre-op process and how she was thinking about what size she was going to get, and it follows her all the way through recovery. This shows us marking in the surgery center. I do all my surgeries in an outpatient surgery center at North County right now. We have a lot of experience with plastic surgery patients. Surgery is over in about an hour and a half for most patients.
And recovery, like I said, is fairly simple. Within a week, most people are back to a desk job or even a light-duty job. Within 2 weeks, you can get back to cardiovascular activity. And within 8 to 12 weeks, you can get back to CrossFit and really intense things with your upper body that you were doing before. A lot of people ask about kids. After 2 weeks, if you can crouch down and pick them up and hug them close, you can pick them up. So now let's get to some of the before and after photos. So the thing to keep in mind about these is that every patient starts with different anatomy, and every patient had different goals as far as size and whether they wanted to either avoid a lift or, I tried to not put pictures in here that were lift pictures, so these just tend to be straight augmentations. So this is a patient that came in after having children, pretty little breast tissue left behind, really no significant sag, but just kind of emptying out. So her goal was really just to barely fill out the breast skin without significantly changing the breast. And I've chosen some pictures that are pretty quick after surgery and some that are very far out after surgery so that you can see implants in various stages of kind of settling. So we'll flash to her next photo. This was a moderate plus profile implant she chose. And this is pretty quickly after surgery. This is about a month after surgery. So you can still see that the implant's fairly high and hasn't completely settled into place, but it's really well on its way. By this point after surgery, all the swelling is gone, so size-wise, you're about where you're going to be, but the breast just isn't quite as filled out on the bottom, and the implants have a little settling to do in the upper part of the breast. Next slide, please. This is the same patient again from the side, showing that the implant is on its way down, but not quite there yet. This is a patient who had the Anatomic Style 410 implants. And there are 2 different sized implants used. These were moderate height and full projection so that it filled the breast just to its borders on the superior part of the chest and filled out the skin as much as necessary. With these 410 or form stable devices, the size is really, really based on the dimensions, width and height of your breast. That's pretty much it. It's not like you can say, oh, I want a 250, I want a 300. It's really kind of a dimensional planning kind of surgery. So you get the implant that fits your body, basically. This is her from the side. You can see a very, very natural slope. And we can show it from the straight side too. All right, next slide. So this is a patient that is, believe it or not, 2 weeks out from a saline breast augmentation. Just to show that even before the breast is softened and settled, the appropriate sized implant doesn't necessarily have to look artificial even right after surgery. We can show from the other angles. This patient had 2 different sizes because she did have some asymmetry preoperatively. And I have a funny story about this patient. She came in with her mother. You can stay on the other photo. She came in with her mother several months later, about 8 months later, not for an appointment of her own, but just with her mom. And she just had me check her implants out real quick. And I actually said, we use silicone, right? And I was fooled. They were saline implants in a patient that had an A to B cup breast ahead of time. So it just goes to show, if you pick an implant that fits your breast, they're going to feel and look natural. Next, please. This was a patient who's about 3 months out from having a high-profile breast augmentation with 375 milliliter implants on both sides. And she has a nice roundness to the upper part of the breast and is just kind of filled out. This patient also had high-profile silicone implants. High-profile implants are probably, you can keep scrolling through her pictures, probably the most common implant in the United States. US, actually, the high-profile, which is the Style 20, 350 milliliter implant, is pretty much the most popular implant. For most patients, it's going to fit their frame. And you can see she's pretty quick out of surgery, too. Her scars are still barely even healed at this point. So sometimes these implants have a lot of settling to do, but I wanted to show at various stages so that people could know what to expect after surgery. For a certain period of time, there is going to be some roundness to the top of the breast. The incisions can be visible before the breast settles, but that's eventually what's going to happen. All right, next picture, please. This is a patient who had a little bit of sag, and depending on what she wanted, we would talk about whether to do a lift or an implant above the muscle to kind of fill out the tissue since she had enough tissue to mask that implant. So this is a textured high-profile implant for this patient that was placed above the muscle. And what I want you to notice from the next slide is that from the side, she still does have some breastosis, but she didn't want to lift, and she didn't really need a lift. Every patient's goals are different. If she was fine with the position of her breast and just wanted that volume back, I have many other patients that would have wanted to lift all that breast tissue above the fold and go with a slightly smaller implant or a less projecting implant. That's why the communication is, again, pretty important. Next slide, please. This is actually a revision case with change of implants and a lift, so I'm going to skip that one for now. This is a patient that had 2 different size moderate plus profile implants put in, and she is also about 3 months after surgery. Goldberg picture. A lot of our patients come in after having children and say, I just want to be the size I was when I breastfed. And there's a pretty safe way of filling out the breast in surgery with those sizers and making sure we can just kind of fill the breast back out without stretching it or changing it significantly. All right, next slide, please. Yeah. I think this is actually a repeat. You can go through these. This one ended up in there twice and somehow didn't bleed out. Right, this is a recent patient who actually is only about a month out after surgery there, who had high-profile textured implants put in, and her recovery was extremely quick. Most patients, like I said, have a much faster recovery than they imagine they're going to have. This patient is now about a year out after surgery, and these were moderate plus profiles, 2 different sizes, in the 250 to 300 range. Implants do also depend on your height and your build. For smaller patients, height-wise, even if their breast diameter matches a larger implant, sometimes it's wise to go with that smaller size just because it fits the frame better. Thank you very much. I'm going to have Kimberly come back up here and talk to you about our drawing for this evening, and we're going to have some implants available for you to look at and check out in the back, as well as some of the garments we use for patients after surgery. Okay.
So I don't want everybody to rush out of here really quick, but I'm going to have the rep from the company, the manufacturer, Allergan, is going to be in the back. He can really go over and discuss anything with you guys if you have questions.